Hey everyone, it's Dr. Rueben with today's consult. I want to talk today about autism spectrum disorder. I'm seeing an increasing number of young people, teenagers, coming to me who don't have an awareness of the fact that they have an autism spectrum disorder or that they are sitting somewhere on the autism spectrum. The issues and symptoms that go along with this disorder really can be a distraction to a person's life. I thought I'd talk about what that looks like in hopes of giving parents and the young person insight into what's happening. And this helps a person understand what types of resources they might need and what might be available to them. What tends to happen, what I see coming into my office, is that teenagers are coming to me in emotional distress. So you're going to see some sadness or some affective difficulty. But what you're also seeing is that these young people are having real significant trouble in their interpersonal relationships, and that is trouble with reciprocity, the give and take of a normal social interaction. If I am talking to a person in a conversation, there's going to be a give and take. I'm going to talk, and then the other person's going to talk, and I have to know how to read their facial expressions, understand what's happening in our conversation, know to pause when that person is talking, and then when that person pauses, it's my turn to talk. What you're also going to see is trouble with their nonverbal communication skills. So trouble with eye contact, reading body language, or appropriately conveying body language that allows you to understand what they're going through. And because of some of these issues, they also will tend to have trouble making friends. What you'll see is that this person becomes isolated, starts to feel like they're alone, starts to feel like they don't have friends. You also might see repetitive and rigid behavior. So in other words, verbal or motor tics. So, kind of flapping or very, very rigid and repetitive behaviors like lining up all their toys, or really, really meticulous about the way they put things away, things are in their room. And they will be really, really rigid about changing any of these things. Changes in routine, changes in the structure of their room, changes in anything that is part of their daily routine. Those changes are going to be really distressing for a person on the autism spectrum. If you see this collection of behaviors in your young person, and you see that they have persisted from early on in their childhood, it's possible that the emotional distress and the social distress that they are experiencing can be explained by autism spectrum disorder. Now, it's important that you understand you're on the autism spectrum for a couple of reasons. The first one being, if you are on the autism spectrum, you need help in a different way. A neurotypical depressed teen that comes to me and is depressed, I will help them in one way. A person who's on the autism spectrum is really going to need a different kind of help. They're going to need help learning the ways that a neurotypical kid would interact so that they can have more social success. Understanding that you're on the autism spectrum is going to open up a set of resources for you that we don't think of and we don't apply to a sort of neurotypical young person. True behavioral help, concretely helping a young person learn that social reciprocity, is going to help them have more social success, which will lead to less affective trouble. So in other words, as they have more social success, they will be less sad because they won't feel quite as isolated. And also, understanding that your child is on the autism spectrum will make it so that you now understand how to interact with them in a way that will not be so disruptive for them. Oftentimes I see a parent asking of a person something that is outside of the realm of what is reasonable for that young person. So you want to understand what your child is capable of, how they are wired. And if they are wired differently than your neurotypical kid, you want to interact with them in a way that is different so that they can have success. I hope that this will be helpful for you. Just think about these symptoms, and if they might apply to your young person, look for the autism-related resources in your area. This can open up a world of help and resources for your young person and for you. So I hope this was helpful in shedding some light on what it looks like for a young person that is on the autism spectrum. That's all we've got for today. I'm Dr. Rueben, and this is House Call.